Hello, everyone. We are back to have a discussion about the coronavirus. Today, I am very interested in learning about how people in Nigeria are dealing with the reality, because considering the fact that as Africans, Nigerians and others in Africa are actually used to living gregariously. We're social animals as Africans. We really like to associate, get together, and just have fun. And the societies there are also usually packed with people constantly moving around. But it is a new reality now. And today, my guests and I are going to be looking at how Nigeria is dealing with this. I know that in the past week or two, the Nigerian government at various levels has been trying to address this. So I am going to be asking my guests who are right there on the ground to enlighten us on what is happening in Nigeria, in the hope that people in Nigeria and in fact across Africa, when they see this show, would also have one or two things to take away from it. So today I have with me Mrs. Edith Uwugiaren, who is Assistant Director of Nursing at the University of Benin Teaching Hospital in Edo State, Nigeria. Mrs. Uwugiaren, welcome.
Thank you very much. Nice to be here.
Right. We also have Mrs. Bridget Russel, who is the founder of Kleros Montessori School in Benin, which is a very thriving private school in Benin. And today, Ms. Russell, I hope that you can also speak to us about how you are dealing with this reality with the children in your school and their families, because I know that a teacher's job never ends. So welcome. All right, welcome.
Thank you, Prof.
Right. So, Mr. Fatuase, welcome back. You were here with us last week. I know it's only been a week, but perhaps I can call you a veteran. But you are also a journalist who first cut your teeth with Punch Newspapers Nigeria. And right now, Mr. Fatuase continues to work as a journalist. He's someone that I have known for a few decades. Currently, he's also a biographer, a content creator, and a media and community relations consultant based in Lagos, Nigeria. He is also the editor of thenewstuff.com in Nigeria. So welcome to you and welcome to all of you.
Thank you very much.
Right. So, right, Mr. Fatuase, my first question will go to you. Over the past week, there has been a lot of effort by the Nigerian government, as I said previously, to actually begin to deal with this crisis. My question to you is that based on your understanding, based on what you see, are people responding well to what the government is doing?
Good afternoon once again from here. Coronavirus seems to be the topical issue in the last few weeks, let's say from February ending until now. And like I said at the earlier program, as a journalist and as a community relations person, I am yet to get a feel of the kind of awareness that is required to tackle an issue, a pandemic like coronavirus in Nigeria. Enlightenment in terms of what people should know, how people should go about this, that is the preventive aspect of tackling a pandemic of this nature, as well as a way of curbing the spread of a kind of disease that is beyond comprehension to so many people in Nigeria. So far, it's been a case of government telling us they are doing this, they are doing that, putting structures on ground, looking for facilities or trying to source for facilities like ventilators, putting up isolation centers, and all that. But the message that sinks with the people as of today has basically to do with a rise in the figure of cases. You know, as a journalist, you just see this thing, you see a progression, and it scares you. And what you expect basically is to see government in action.
Right, but are
And
the
so
people...
This is what we are doing.
Right, my question is, are the people responding now to what the government is doing so far? How are the people responding?
Well, there seems to still be a kind of disconnection somewhere. People are not responding as expected because, like I said, what we are having are just news reports of government is doing this, government is doing that. Those things have not really touched the people in the way that you would expect when you compare this situation in Nigeria to what is happening in other countries across the world.
All right, Mrs. Uwugiaren.
If I would be...
Yeah.
I saw your state governor, I think it was just several days ago, announcing all of these measures in Edo State. For example, no gathering over 50 of more than 50 people.
Yeah.
And everybody is now expected to work from home, except essential workers. And he laid out what seemed like a really great plan. And I would like to ask you, as a nurse, would you say that people are responding to that? And that question is particularly important, especially when you look at the news item that I just put up on the screen, which says that the COVID-19 cases are rising in Nigeria. Can you tell us what you are seeing in your hospital, and also what you think the people are doing to respond to the efforts that your government has laid out?
Good afternoon again, everyone. In those states, it is now a law, as it were, no gathering beyond 20 persons per time. Then all the motor parks have been mandated now. They have wash stations, they have sanitizers, and the number of passengers they are to carry have been reduced to ensure a little bit of the social distancing. In the market, those selling only food items and drugs are the ones that are permitted to open their shops, be it on the street, be it in the main market. So I think yesterday they have to use the efforts of the law enforcement agencies to ensure people comply to that instruction. Then at the hospital level, we don't allow more than one relation per patient. You know, according to as our African culture, people usually will come as a group if they have one ill person. But right now, if you come to the UBTH, for example, the whole premises is empty. Before, taking care of a guest, controlling crowd is a challenge in the emergency area. But right now, one patient, one relation that will go around to sort out things for the patient if they need arise. So about the people compliant with it, I would say they are doing well. It's beginning to dawn on everybody that this is a challenge, that if we don't obey simple instructions, if it escalates, we have nothing else to do, cannot help ourselves, as it were. No country of the world to depend upon right now because everybody's trying to sort out themselves. So in terms of compliance, I think our people are doing well.
Right, so that also tells me then that there is something to be happy about. In other words, it seems to me that what you're saying is that people are beginning to get the fact that this is a reality. So Mrs. Russell, would you agree with that? What are you seeing as someone who is the proprietress of a school and a community leader? What are you seeing? Are you also seeing what everyone is saying, that people are responding? In other words, people now believe
I
that...
would say I would say people are responding. I would agree that people are actually responding, and the awareness is getting stronger and better. And as a children teacher, for the Kleros Montessori House, we actually are like a people who anticipated the crisis, because in 2011, we actually went to the Nigerian Red Cross Society, the chapter here in Benin, asking that we be registered as a school. And once a child turns 3 years, the child is allowed to join the Nigerian Red Cross unit. They become certified as time goes on because they write exams within the school, and they're certified to do first aid. We teach them issues of humanitarianism and all of that. And then when this crisis started, before it even started, we set up wash basins at the entrances of the school, and we followed the hand washing procedure. We insisted that parents must give their children hand sanitizers. So by the time the crisis started, we were not surprised and were not thrown off balance at all, because the children were already used to washing their hands. And I would say that in the local community where I fellowship, we are adhering to the government's policies, not more than 20 people in the hall at the same time. We're also doing online services. I've not been out since schools were were announced and told to close up. I have actually been at home with my grandson, teaching him, and I just started an online class with the parents today. We'll be having starting our class today, learning the sounds for the nursery children at 7:30. So that's my own way of also giving back to the society.
Well, thank you very much. So it seems to me that we should actually be happy about some of the news that you are presenting today. There are many reasons why I think that is the case, and one of them is the fact that I understand very well that for the last few weeks, in fact, up till last week, there were still many people back in Nigeria who were denying the existence of this virus. And one of the things that I liked in listening to the governor of Edo State, Governor Obaseki, when he was laying out his plan, was that he was actually saying to the people, these are the things that you need to do to avoid this. Stay at home, wash your hands, and real basic things that we need to know, because this is preventable. We really know that it is really not, it's not a death sentence, so people can actually get it and survive, and there are many survivors. So, Mr. Fatuase, my question next is to you. What is the role of journalism in ensuring that what the government is doing really gets to the people, that the people understand how to take care of themselves, that the people understand how to make sure that this doesn't spread? Because there is no perfect government, and the federal government of Nigeria and the state governments will do whatever they'll do. But I think that the information still needs to be disseminated somehow, especially to people who don't live in the cities, people who live in the rural places of Nigeria, of which there are many. How do you see your role as a journalist and the role of your profession to get this to the people?
I must say that so far, since this issue started, journalists have been up and doing and reporting in many cases as to what government is doing across the state. So should I just say the different state governments, and even at the federal level, the federal government, what they are doing. In terms of facilities and provisions, these issues have been reported in the papers at different levels, both in the urban areas and at the grassroots. Reports of government trying to get ventilators, trying to get facilities, that one is always there. And in particular, let me just refer to what Lagos State is doing, because Lagos State seems to be the epicenter of this matter as of today. Lagos State records the highest figure so far, 52 out of the 81 that is being shown as at today, as at this morning. And journalists have been very busy trying to list the different projects. I will take Lagos, like I said before, and the different projects being done in Lagos, not only by government, but by institutions like banks, what they are doing in terms of their social responsibility, CSR, trying to assist government in the provision of some amenities. There's a particular bank that is practically turning a local stadium here in the city of Lagos into an extended hospital or something like an isolation center. This one will assist. There are cases of organizations donating money just to help in providing facilities and ensuring that the issue of coronavirus is addressed in the way it should be addressed. So far in Lagos, and I know that in other areas too across Nigeria, like in Rivers, Edo, Ondo State, Ekiti State, there are reports of the activities of government in trying to curb the movement of people across borders, across states. In some cases too, intra-state movement too. Government, the journalists have been reporting issues about this. So in some way, all these ones are really showing and emphasizing the fact that awareness is being created. What I said earlier was that comparatively, when you look at the enormity of the problem and the issue of enlightenment, a lot still has to be done. So government across is doing a lot, and journalists are reporting what they can see for now.
Mrs. Uwugiaren, when you look at the stats, the statistics, and if you look at what I have just put on the screen, since we have been talking over the last few minutes, many more people have been reported infected around the world. 618,043 people as of this minute. In the United States, 104,865 people have been reported infected. In Nigeria, only 81. I am not sure that any of us here believes that that's just the number that the entire Nigeria has of people that have been infected, which means that there are many cases that are not being reported. Because if you really don't go to a hospital in the city in Nigeria, you probably are not getting counted as having been infected. But you are on the ground, Mrs. Uwugiaren, you are in a hospital. Are you seeing a lot of cases in your hospital? And is your hospital currently getting so many patients with a kind of frequency that may be surprising that you probably would like to speak to us about?
Well, at the University of Benin Teaching Hospital, in fact, patient influx have actually reduced. The upper week, there was a rumor that there's a case of coronavirus in UBTH, and everybody started running. People calling in from town, is it true, this or that? But for confirmed cases, no, we've not had any. As at today at the University of Benin Teaching Hospital. But beside that, there are a lot of things our management is doing. At every major entry point, there are wash stations, drums of water everywhere. So no excuse of you're not able to wash your hands. They try to at the reception where people sit, the chairs have been removed so I don't give people room to gather, to be comfortable at any time tea in a place. So on their own, they are doing a lot of things. Right now, like I said earlier, patient relations don't even come around. If you have a patient, it's a hospital policy, 1 relation per patient. We don't want anybody to cluster around. We don't have any cases of, there's no pressure whatsoever right now. But I
Right.
also want to agree with the fact that there may be cases that are not known. Because like I tell people, our second home as a Dolite is Italy, is Spain, and other countries of the world. Some persons may have come in and nobody knows about them, but it is only what is reported officially that we are seeing, 81. But the likelihood is there could be 1 or 2 persons. So I tell people, behave as if you are in the UK, behave as if you are in China with the pandemic. So don't just assume that, oh, because they recorded 2 officially in Edo State, or because they have recorded 1 in River State, then it is 1. Then everybody should just be careless. Let every one of us as Nigerians behave as if it is everywhere, it's on your street, it's in your neighborhood.
Right. Thank you for that. And one of the things that we say to one another here in the US, and which our public health experts tell us to, is that we should all behave as if we may be infected. So it is our responsibility also to make sure that we do not get others infected, because we may or may not be infected, but we should just behave as if we are. In that way, we can protect ourselves and protect others. So, Mrs. Russell, my question next is to you. I mean, you live in the city, but you also know the countryside. You know some of those villages. And how do you think, what do you think is the best way to spread this information that you are telling us is in Lagos and in Benin, and there is this public awareness? What do you think might be the best way to spread that kind of awareness to the villages in Edo State or anywhere in Nigeria, so that everybody will be aware that there is a problem and what they all need to do to take care of themselves and their neighbors?
Well, as it is right now, it appears like the average Nigerian thinks that the coronavirus is with the rich men, the politicians, because those are the ones we hear about. And we have, like somebody told me, the mother called from the village a few days ago and said, I hope you have made your own hand sanitizer. So I'm like, how did they hear about the hand sanitizers in the villages? He said, I don't know. He said, my mom said, we soak bitter leaf in ogogoro, and in the mornings, we take a little shot and give to the children around. So I'm like, so everybody becomes high. I think the government should do more than that. Send some health workers, equipped health workers, into the villages just for sensitization. Get megaphones, talk to the chiefs. And that's one thing the governor has done, the governor of Edo State. He called a meeting with the traditional rulers. And I think that will help. If the traditional rulers actually go back to their domains, go back to their villages, to their communities, to call the chiefs, and the chiefs in turn will call the heads of families to meetings and talk to them about sanitizing, washing hands with soap, talking to the children and everybody. I think it will go a long way.
You know, I really would like to thank you all for joining me this morning in the United States, but it's evening in Nigeria, right? So I really like to thank you for coming. But just before we end, I'd like you to just say one word of encouragement to everyone in Nigeria, because my feeling is that everybody needs to know that it's not a death sentence if you've been diagnosed with the coronavirus. There is treatment, but you need to come forward as soon as you begin to get those symptoms so that you can be treated. But just one word of encouragement, one.
My good people of Nigeria and the world over, prevention, they say, is better, safer, cheaper, more economical than cure. Let us play by the rules that we have been given avoid social gatherings, ensure social distancing, cough into your elbow, sneeze into your elbow, everything we can do to protect ourselves and our loved ones, and we will overcome.
I'm smiling because Mrs. Uwugiaren, you just sounded like a nurse and a mother. Very perfect. And I actually have heard a jingle that you made for the University of Benin Teaching Hospital, which was really fantastic. I am going to play that at a subsequent show. Mr. Fatuase, just one word to the people of Nigeria. One word from you, Mr. Fatuase. I'll go to you, Mrs. Russell.